Are you overwhelmed caring for an aging loved one? Whether you're an adult child, spouse, partner, friend, or a professional caregiver, then this podcast is for you. Welcome to your Silver Lining. Each week, we bring you valuable content to help you provide the best care and support possible, along with tips on how to care for yourself. Your Silver Lining hosts will cover topics such as recognizing when a loved one needs help, advocating for them in the emergency room, managing medications, maintaining fluid and nutritional balance, handling acute and chronic diseases, and much more. And now for the disclaimer. Keep in mind the information you are about to hear should not be misconstrued as medical or legal advice. See the full disclaimer below. And now on to the show with your hosts, Stephanie and Paige.
What happens when a missed pill today turns into a crisis tomorrow?
Great question. Roughly 125,000 people in the U.S. die each year due to medication non-adherence, and many of those deaths are preventable. Hi there, I'm Stephanie Cameron, and I'm your nurse care manager. I'm also the owner and founder of Transitions Care Management, a concierge care management practice here in the Seattle, Washington area.
Hi, I'm Paige Selden. I'm the operations manager for Transitions Care Management. And together, we're the hosts for your Silver Lining podcast.
Yay, and welcome. We are so excited to have you here. Today, we're going to be talking about a great topic. We're going to be talking about medication management, something that almost everybody can relate to if you're caring for an aging loved one. So let's dive right in.
Yeah, let's do this. Medication management might mean something different to our listeners. So in the context of our world, what does medication management entail?
Yeah. So in our world, it is an incredibly comprehensive process that we have in place for educating and managing medications for our clients. It's important to understand right dose, right time, right person, right medication, that the people are qualified to give the medications and watch for side effects. And, there's a lot involved. And by being different for everybody, your role as a caregiver is going to be individual to the person that you're caring for and their level of comprehension and how they're able to manage their own medications. There's a lot of other factors involved. So you may hear us talk about some really, really involved processes and a lot of detail. And this is all information for you to glean from and take from it what works best for you.
So why is it so especially critical for older adults?
Yeah, boy, that's a tough one because they're often taking multiple medications, which is also called polypharmacy. If you hear that term, it just means they're taking, I think it's more than 5. Is that what determines polypharmacy? So. I don't remember the exact number now.
Yeah.
And so, so it increases the risk of dangerous interactions. There can be other things involved, like confusion, non-adherence. So, all these things can lead to negative medication impacts, including hospitalizations.
Oh, yeah. So let's talk about the cost of non-adherence. What are the real consequences when older adults don't follow medication instructions?
So stakes are high. I mean, non-adherence has many arms of influence and impact. So as we mentioned earlier, 125,000 preventable deaths every year in the U.S.
Man, that's a lot.
It accounts for, I know, right?
Yeah.
It accounts for 10% of hospital admissions. Up to 40% of nursing home placements are due to adverse drug events, apparently. In doing the research, when you were doing the research for the show today, I saw that number. It's like, are you kidding me?
Yeah.
Really?
So do you have a real world example?
Yeah. This one happened with a client of ours. This has been a while back, and it was pretty early in our involvement. We're still trying to assess. Family was managing medications. They were doing everything right. They had great systems. They had caregivers in the home. And the client ended up in the hospital, and she had this crazy drop in blood pressure, fainting and falling, and they couldn't figure out why the blood pressure was so low. Well, the family investigated and found out that 3 days worth of her morning medications were missing, and they had just filled the medication sets, right? So let's say she had a Monday, Tuesday, Wednesday. Those were 3 days worth of blood pressure medications. Because what had happened is she had reached that tipping point with her cognitive abilities.
Mm,
And it's hard to know when that point is coming. We'll be talking
yeah.
about that in signs to watch out for. But she had taken a dose, forgot she took it, and didn't remember what day it was. So she took another and then went back and then took the third, and
Ooh.
it landed her in the hospital.
Oh, wow.
Yeah.
Yeah. So, what are the health risks for a missed or inconsistent medication dosages?
Yeah, there's a lot. I mean, it can cause a disease process that might be, like a chronic disease process to have a quicker progression. There can be rebound effects from stopping a critical drug that needs to have a taper, maybe to stop
Oh,
it.
right.
There can be a toxic buildup in liver or kidneys, which are two of the areas of our body that process most of the medications that we take. By taking too much or too little, it can impact the balances there. Um, in psych meds, that can spin somebody into a mental health crisis if they have stopped taking their psych meds, which we do see um, with some regularity. And then most troubling is many people don't connect like a lot of these crises to a medication issue. They're looking for other things, especially if the individual isn't even aware themselves that they've done something wrong. They may say, my medication just isn't working. And that's what you're going to the doctor with as a caregiver. So we'll talk in this episode about how to really watch that and maybe determine, hey, is what's going on actually because of medication mismanagement? Maybe it's not something else. It's simply because they didn't take that crucial pill for 3 days.
Yeah. So,
Yeah.
what's the emotional toll on that?
When we take pills, right? If we have to take a prescribed pill, we know at 8 o'clock in the morning, we take it and we don't think too much about it. And for somebody who maybe has some cognitive impairment that's coming on, first of all, realizing that they're being forgetful about things can be difficult as it is, right? They naturally start compensating. Right.
Oh, yeah.
They may not tell you that they're forgetting that they found their keys in the freezer, right? Or couldn't find their car in the parking lot of Costco for the third time in a row or something like that. So they may not communicate those things. And it's no different with medications, right? They may not tell you. So the emotional toll is there may be shame, fear, and then mistrust towards providers too. If they may think their medications aren't working right, but it's really that they're
Right.
not taking them properly. So there's a lot
Wow,
involved
that's
there.
complicated.
Yeah. And
Yeah.
then for caregivers, the emotional burden can include anxiety, guilt, burnout when things going wrong and you just can't get to the bottom of it. And it can put strain on the relationship as well.
Absolutely.
Yeah.
So, what would you say is the financial impact of medication mismanagement?
Yeah. This is another one that, doing the research, the numbers that you had come up with that you had found, these are, we'll put links to the statistics that we're quoting here, is 100 to 300 billion dollars in avoidable healthcare costs annually.
That's nuts.
Right?
Yeah.
Yeah.
I mean, I thought scams were bad at 3 billion a year.
Yeah, make sure you check out our scam episode,
Yeah,
by
it's
the way.
great.
And $11,000 to $15,000 per hospitalization as a result. And then if they have to go into long-term care or into a community, it can cost $7,000 a month or more for long-term care due to medication-induced complications.
Just shocking.
Yeah.
That's shocking.
Yeah. So skipping a pill can literally cost a fortune. Maybe not one pill.
Yeah. Right.
But you get where I'm going.
Yeah. We can say that. So, let's talk now about some of the barriers to medication adherence. What are the most common barriers that prevent older adults from taking medications correctly?
Yeah. And this is a great one to remember and take note on. And we started to talk about it a little bit earlier. One is cognitive impairment. We tend to protect and compensate as cognitive impairment is beginning to develop. And in medication management is definitely one of the areas that can show up in. Low health literacy. The healthcare system is complicated. Medications are complicated. Take a look when you get a medication, what a seemingly simple medication, and it has 5 pages of fine print that come along with it. It's a complex system and a complex set of information that you're getting right from the get-go. So, unless you have somebody there holding your hand and guiding you through, it can be difficult
Well,
and
I was going to
challenging.
say, maybe that's like a good plug for going to when you go to the pharmacy to pick up drugs, talk to the pharmacist.
Mhm. Yeah.
They offer, so
Mhm.
take them up on it.
Yeah, that's actually a really, really good point, because we make medication decisions ourselves based on what we know and what feels right. Right. And sometimes those decisions aren't the best decisions for us. Right. And we may end up with a negative impact, from that decision. I skip the pill today, I'll take 2 tomorrow. That makes sense to me. Right. Well, maybe not.
Yeah.
So, and then complex regimens, which would be the polypharmacy, taking a bunch of medications, not only the number of pills, the timing of them, that type of thing. Financial hardship. Medications can be expensive.
Yeah.
Yeah. Also, if you're over 65, I'm just going to do a quick little plug for reviewing your insurances and medication benefits every year when you have open enrollment. We'll do another episode on that as well. Super, super important. This past year, I actually got several phone calls from clients who we thought were in really good insurance and medication programs. And a couple of the big carriers actually dropped a bunch of medication benefits. And so I'm getting calls going, oh, I just got a letter saying that we're not, this medication isn't covered. So it's always a good idea to reach out to a broker or somebody that can help you with your Medicare benefits during that open enrollment period, because things do change.
Yeah.
So financial hardship, that's one of the things you can do for yourself there. And then mental health or psychosocial factors is another one as well.
Going back to the financial, I did want to mention that, with really expensive medications, go straight to the manufacturer.
Oh, yeah.
Oftentimes they'll have coupons or they'll have programs, because they want you to use their meds.
That's a great point. Yeah, always go to the websites. Yeah. I love that.
Hunt down the discounts.
Yep, for sure. For sure. Yeah.
Yeah. So, how can caregivers identify these barriers even when their loved ones don't verbalize them?
This is actually one of the key things that you can do, because often they're not going to verbalize it, right? They're not going to come to you and say, oh, I missed my pills 3 times last week. I'm not sure what's going on. It's likely not going to happen. So there's things that you can watch for. So behavior changes, changes in their medical status, or just changes overall, cognitive changes. How are they caring for themselves? And watch for some of these things. And when you're looking at medications, look for unfilled medications or unused blister packs, or on the opposite end, a medication that was filled, let's say 3 months ago, with a 30-day supply, and there's still half a bottle there, right? So there could be that, or a pill bottle that was filled 2 weeks ago with a 30-day supply and is empty, right? So look for those imbalances. Confusion about dosage, if you're talking about medications and, your loved one can't say, yes, I take one of these a day. They take, well, I think I'm taking one a day, or am I supposed to take that one twice a day? When, if there's conversations about that confusion like that, if they experience new or worsening symptoms, again, observing how they are. If they have blood pressure issues and they complain about headaches or dizziness on one end or the other, it could be that the blood pressure medication isn't being taken properly. Avoidance behaviors, mood, and motivational shifts as well.
So how do you figure out whether it's non-adherence or forgetfulness, fear, or something deeper?
Looking for patterns is a big thing. Forgetfulness, would be a big one, and it could be an indication of early cognitive decline. It could be from taking the medications improperly. So don't assume,
Oh,
right? There's a lot of
good
factors.
point.
Yeah. There's a lot of factors here. Vague complaints that might point to anxiety or depression. Might be something. So each case is different. You hear us talk a lot about documentation. That's our favorite word in tracking and documentation. So when you're noticing changes, maybe start jotting them down in a little book. Start having open communication as much as you can with your loved one to encourage and foster safe communication. So if they are struggling a little bit, that maybe, over time they can feel safe talking to you about it, saying, gosh, I'm feeling kind of dizzy lately. I don't know if my medication is working, or maybe I'm not taking it right. If they don't feel safe saying that, it's just going to stay inside. And that's when you end up with a potential medical crisis. So try and foster those situations. So, yeah.
So going back to, you've mentioned, cognitive decline has an
Mhm.
impact on taking medications, but are there medications that can mimic cognitive decline or cause it?
Yes, absolutely. Again, talk to your doctor and pharmacist, but this is a big one. We are like in our aging clientele, we typically recommend not taking Benadryl or those PM medications without talking with your doctor. They can cause confusion, kind of the hangovers the next day, cause some cognitive impact. And with the Benadryl diphenhydramine, there is some studies that say over the long term can actually contribute to cognitive impairment. So talk to your
Scary.
physician, talk to your pharmacist. Yeah.
And those what you're talking about are like over the counter
Mhm.
medications. So it's harder
Yeah.
when, you've got prescriptions and you're talking to your pharmacist, but then you go and grab some Benadryl and,
Yeah.
cash out at the front.
Yeah. Oh, that reminds me, went into a home, this has been several years ago, I guess, and did a medication audit, for the individual, and lots of confusion, super sleepy during the day, was trying to figure out what was going on with mom. And she was managing her own medications and in various forms, whether it be like a pain medication with a PM component to it, allergy medications. This person had 7 Benadryl in her medication sets throughout the day and the night.
Like in different products, or oh my gosh.
Yeah. So like 7, the equivalent of 7. And she was just stoned, I mean,
Wow.
like, and we were able to get those out of there, audit the medications, work with the doctor, work with her on education in the family. And she did a complete turnaround, but she was just drugging herself out,
Wow.
not understanding the implications of it, not understanding that it was actually the medications that she was taking that was making her feel this way.
So, are there cultural or generational issues or, that impact medication management?
Yeah, and that is such a big question. We're going to do an episode dedicated strictly to that. So I'm so glad you asked that question. Um, and the short answer is yes. There can absolutely be implications not only to medication management, but to how your loved ones accept care, how you talk with them about care, how that care is managed, how that care is received in a hospital. I mean, there's a world of considerations in that. And so the short answer is yes, be aware of them. And we are going to do an episode going into more detail
I
on that.
knew I was going to open a can of worms.
I know, right?
Yeah. Oh my gosh. So let's talk a little bit about the tools and strategies that work. What systems actually help older adults stay on track with medications?
Yeah, pill organizers are your first and best, right? The little plastic containers with the compartments, and they'll come in like a 7-day pack. And if somebody's taking meds once a day, you can do the one that's 1 row, right? If they take meds twice a day, you can do one that's 2 rows that says AM and PM on it, up to 4 times a day. For somebody who takes them more often, I will often, and we did this for somebody who has Parkinson's disease and he's taking medications 5 or 6 times a day. And so I took the 1 row, right? The Monday, Tuesday, Wednesday, Thursday. But I did one of those per day. And instead of the Monday, Tuesday, I wrote the times on there, right?
Oh, wow.
And so that person, the caregivers would just grab 1 whole slot for the day and they can do up to 7 passes in one day. So there's ways you can get around it if people are taking more frequent medications, but that's a good first start. So then it's a matter of compliance, right? Is the person able to take the meds at the appropriate times? And I know this sounds really silly, but don't be dissuaded when meds at, let's say, a four row one says morning, noon, dinner time, and bedtime. And you're like, well, that doesn't work because these meds are 8 in the morning, noon, 2 p.m., and 8 p.m. Yeah. Right? Just get a label maker.
Get a label maker. Right?
Yeah. And just customize them the way you want them.
Yeah.
So yeah. And I know that sounds silly, but we've come across that.
And you'll find other uses for the label maker. So yeah.
Another one is pharmacy blister packs. Talk to your local pharmacy and see if they offer those. Now, in the blister packs, I do recommend that the individual's medications are stable and I'm not changing all the time. So if you are in a mode of seeing numerous physicians, like let's say you realize that mom is really struggling and you're stepping in and having to help. And in that stepping in, you realize she hasn't seen her diabetes doctor, she hasn't seen her heart doctor, hasn't seen her general practitioner, hasn't seen, her dermatologist, whatever it may be. And so you're getting all these appointments in line. And she hasn't seen people in 2 years. They're going to do medication reviews. They may do medication adjustments. And so while this process is happening, I don't recommend doing blister packs because there are going to be changes and it's going to be hard to keep those blister packs current until you get a stable medication routine. So the med boxes and you filling them with your mom would be the better solution. And then once you've gone through all the doctors, the medications are stable, we don't have big side effects, they're working well, then you can reach out and see if a pharmacy can do blister packs for you.
That's great advice.
Yeah.
That's great advice.
There's also, so that's the pill organizers. There's smart tech, there's reminder apps, there's automatic pill dispensers. We'll put links to some of our favorites. We're also going to put links to others that we've heard of, but I want to be really, really clear. We're not like endorsing particular ones. It really is up to you to do the research and find the tools and products that work best for you. Now we can put a note next to things of ones that we've used and say, yeah, we like this one. If you don't see a note specifically from us, do your research. We just want to give you some resources. So there's automatic pill dispensers, Alexa and Google voice reminders, wearables with med alerts, another option. And then there's professional collaboration, which would be reconciling. You can hear my dog in the background. I apologize. I just realized I tune her out when she's barking and we're back here. And I was like, oh, that's probably coming across.
But she's adorable. So
she is adorable. Yes.
Totally worth it.
So professional collaboration would be medication reconciliation, post-discharge from a hospital visit. Make sure you're reaching out to the doctor. If there was medication changes, which there often is during a hospitalization, make a phone call to the doctor, which you should be setting an appointment with your primary physician after a hospitalization anyway. So make sure you're reviewing medications at that point so that you're back on track again.
Document.
Yeah. Yep. Pharmacist reviews. Your pharmacist is a great resource for medications because, well, that's what they do. They kind of know. And then let's see, documentation, log sheets that you can do to track things, journals we'll talk about. Communication strategies is another good tool. Fostering really good open communication with your loved one from the beginning. It's important that they feel like they're a partner in their care, that you're not just coming in to take over, even if you're seeing that there's a lot going on and they really need help. One of the best things that you can do is to not make them feel they've done something wrong and that they can't handle things on their own, because there's probably a lot they can still handle. No matter how far along a disease process or cognitive impairment goes, we still make the individual feel like they're a partner in their care to the level it's appropriate.
Yeah, sorry.
No, you're good. You're good.
Well, I think it helps to maintain that trust. I mean, that's That's huge.
Mhm. Yeah.
Because if the trust is gone, boy, it's going to be an uphill battle.
It's hard. Yeah.
Yeah.
Yeah. I think you're butting heads a lot.
Yeah.
Yeah.
A lot.
Which you
And-
might be already at this point, right? If you're
Right.
if the person's in crisis and you're coming in to try and take
Mhm.
over, it's stressful. It's hard.
Yeah.
Yeah. So, let's see, motivational interviewing. This is a fun one. So, recommend doing a medication review with your loved one, right? So sit down and you can get a medication list off of their My Chart if you have access to that, or call the doctor's office for it. But then sit down with your mom and be like, Mom, let's go over your medications. Tell me what you're taking and what each one is for. And so by asking them about this and getting the answers, you're going to get an understanding on whether they're truly understanding what the meds are and if they're taking them right. And if not, it's like, that's okay. That's no problem. That's why we're here to work together with you, and you'll get that baseline understanding. And then linking meds to personal goals. If you take your medications for the purposes they're intended, what do you think you could do? Right? Like, I haven't been able to go out on long walks with my dog for, the past 6 months. Well, if we got your medications back on track again, do you want to put that as a goal, right? Of getting back and maybe doing some longer walks.
And I think, the having health goals,
Mhm.
in mind
Yeah.
is a really, really positive thing for a lot of different
Mhm.
aspects of topics that we talk about.
Yeah. And medication side effects can contribute to, especially if you're not taking them properly, can contribute to reduced health outcomes. And so you just feel worse. And so maybe you're not going out and taking those long walks with your dog because you feel like crap because you're not taking medications right. Right. But if we get you taking them right again and minimize those side effects, maybe we can get back out and do that again. So, yeah, try to find goals that, maybe something they weren't doing before, that if medications were being taken appropriately, that they're able to do that again.
Yeah, I love that.
Yeah.
Oh, also maybe talk about visual medication lists.
Oh yeah. Hey, we're back. We a little technical difficulty there and ran out of power in the battery. So if you just saw a break in the screen, that's why. So let's continue on here.
Let's go. I was just asking you about visual medication lists.
Yeah. So visual medication lists are awesome. You can do, we do this for our clients. And so you do a list, you can do it in an Excel spreadsheet or Word document even. You do the name of the medication, and we'll put an example in the links down below, I think. Yeah, let's do that. So we'll do the name of the medication, what the dosage is, how many times a day, what the medication is for, and then an actual picture of the pill. The problem with that, and something to keep in mind, is that if you're using generic medications, which many people are, is that the medication can change with each fill depending upon who the manufacturer is. So it's a little bit of work to keep the list up to date, but it is well worth it.
Yeah. And also because I do some of these sometimes at work, there are medications that are similar in spelling, so be very careful of double checking the spelling of the medication when you're doing that.
Yeah, it's a real thing in the medical industry. That's something that it is just drilled into our brains over and over and over again, because there's some very similar sounding and looking medications that have very, very different uses. So be really careful about that.
Yeah, she trained me well. So, how do families know which combination of strategies to use? Because the list was pretty extensive there.
Great big huge question. It's different for everybody. The first thing that you would do is start with documentation. That'll be your first and foremost tool. So you're going to be assessing cognitive ability. You're going to be assessing physical capacity. Can they actually open up the bottles and the med sets, even the pill boxes? What's their support system like? Did you bring caregivers into the home, right? So the caregivers get to hand out the meds. That's great. If not, and you're relying on mom to do it, do you need to do a reminder call? So assessing what strategies to use is also going to be a moving target, just to be aware. You're going to have a set of systems in place that work well today, and they might not work next week. But by being familiar with what's available to you, one of the most important is your doctor and pharmacist, right? Getting education and knowledge there, the tracking, the documentation, and understanding what's available to you as far as organizing and support and all that. And you have that kind of in your hopper, right? So okay, we're here right now. If things start changing a little bit, she gets a little bit more confused, we need to bring this strategy in. So by being aware of what's available to you first is going to be one of the biggest things, because it is going to change, and it could change rapidly. So be aware.
It's like a chess game. I mean, you have to think a couple moves ahead.
Yeah, absolutely. Yeah.
Yeah.
Yeah. I'm not a very good chess player, but if I were, then yes.
Yes. So what can caregivers do to support safe medication use?
Centralizing records, learning about each medication's purpose and risks, anchor medications to routines. Maybe
that's a good point.
Yeah, maybe mom eats breakfast every morning at 9 a.m. And can we anchor morning medication pass to breakfast, either before or after, depending upon the medication. So it becomes a routine. When I have breakfast, I take these meds. When I take a 2 p.m. nap, I take these meds. So, anchoring it to something that they already do with routine can be helpful. Involve them in the planning, like we talked about before. That's really important. Ask for simplification of medications. So you might have, here's a big one. You might have a doctor who, like 3 different doctors who prescribe medications. They don't know what times of day. They just know, we want you taking this 3 times a day. And they may say like 8 a.m., 2 p.m., 6 p.m., whatever it may be. Or they may just say 3 times a day. Talk to your pharmacist, talk to a doctor, say, can we consolidate medications so we're not taking 3 different meds at 3 different times in the afternoon? Can those all be combined together? Simplify as much as you can.
What about extended release medications?
Yeah, ask for those.
Yeah.
If possible. Yeah, if somebody's taking something 4 times a day, would they benefit from one extended release? Yeah, great question. Woo, look at you.
Yeah, I'm learning stuff on my job. So I have a recap question.
Mhm.
What's the caregiver's role in medication safety?
Yeah, so big role, along with everything else that you're doing to support your loved ones. So reconciling the medications, eliminating duplications, that can happen as well. Advocating during provider discussions. If you can go to doctor's appointments, you can ask questions and get maybe a better understanding to help your loved one with those medications. Customizing regimens based on ability and cognition, like we talked about. It's about honoring or optimizing safety while honoring autonomy and caring for yourself, at the same time.
Yeah, as we go back to that burnout question.
Mm-hmm.
Yeah, because it really managing somebody else's medication can really be very challenging.
It can be really challenging and stressful. It's a lot of responsibility.
Yes.
So, which is a really good point about caring for yourself. It's so important to care for yourself so you can care for your loved ones. And you're not in this alone. You have resources like this podcast. There's others out there who are really knowledgeable, great information. Your doctor, your pharmacist, reach out for help. Again, you're not alone.
Yeah, I like that.
Yeah.
Should resistance to medication prompt a consultation with a physician or pharmacist?
Yeah, absolutely. And it's a really good question, because resistance can come in many different shapes and sizes, and we may not know what it is. And your loved one may not want to tell you why they're being resistant to a medication, but they might tell their doctor or their pharmacist. So open up those dialogues and conversations, and you may not know the questions to ask, right? So that resistance might be coming from something, oh gosh, I'm trying to think of an example. They just don't like how something makes them feel, right? It's like, it's like, I just don't want to take this anymore. And maybe the doctor will say, after you take it, do you feel a little bit nauseous? Right? I mean, they can ask maybe some questions if the person can't really verbalize exactly what it is. The doctor knows the medications and why they prescribed it. So they might be able to ask pertinent questions to help them kind of,
That's a good
do the
point.
detective work into getting to why they might be resisting.
Yeah, because,
Mhm.
just regular people like me who don't have a medical background wouldn't know.
Yeah.
Like what all the side effects are
Mhm.
for all these different
Yeah, it
medications.
could be a cost thing and also an
Ah,
embarrassment, that they don't want to talk to you about cost, but they might tell their doctor.
yeah. Yeah, that's great. For caregivers constantly asking, is this a symptom or a side effect? What do you recommend for that?
This is where that documentation comes in, and partnering again with your pharmacist and doctor, right? Is they'll be able to assess out whether is it a side effect, or are they looking at the symptoms that you're charting and going, oh, they're just not taking it, right? If they were taking it, this wouldn't be happening, right? So the more you can document, mood and behaviors and any changes you might notice. Are they skipping meals? Are their sleep patterns changing? Are they
Bowel
getting more confused?
movements.
Bowel movements, right?
Yeah.
Chart down anything that you notice and they're willing to share with you. It might not all make sense to you, but you might be building a picture that the doctor looks at and goes, oh, okay, I think I know what's going on here. So,
Clues for Sherlock Holmes.
yeah, exactly. And then that also helps you too, right? So as you're building these things, this list of things that you're noticing, when the doctor says, yeah, this is pertinent and this is pertinent, and this was really helpful, that also helps you kind of tune into what you can watch for in the future too.
Yeah.
Yeah.
So I have I'm going to change focus here a little bit and ask what are the emotional traps that caregivers should avoid?
Oh, man. Yeah. And that's a tough one. And it kind of goes back to that self care that we started to talk about
Mhm.
earlier, which is so important. So don't internalize resistance to either accepting help from you or other people with resistance to taking medications. It's often fear, not defiance. Sometimes it can be defiance, but oftentimes we've seen
Yeah.
it. But oftentimes it's fear, and sometimes they don't even know why, right? So, being patient, helping them be a partner in the care rather than you feeling like you have to tell them what to do, which just creates stress for you and them. Asking for professional backup early. Don't do this all yourself.
Good
You're
point.
not alone. There's resources and help for you out there, and protect your own well-being. You're not just helping somebody live. You're helping them have a better quality of life. You're their lifeline, and that doesn't have to be a lot of pressure. It can be an honor.
You've made so many good points today. I actually, it kind of opened my eyes to, some of y- to the importance of supporting proper medication management.
Awesome.
Yeah, so thanks for
Oh,
that.
yeah, I'm glad you enjoyed it. And like I said, I mean, this is a lifeline for your loved one. These medications are life-saving, life-changing. And so when in doubt, bring in help. Um, thank you for joining us. We really enjoy bringing these episodes to you and having you along for the journey. And make sure you like, share, subscribe, leave us comments. We love to read your comments,
That's
and
right.
we try to respond to them personally as often as we can. Um, it helps us grow our community. Make sure you share.
Yes,
We can bring you more useful and relevant content and information.
it's so true.
Yeah.
Yeah,
Yeah.
and we'll be back next week with another episode. So,
Yeah.
you know, remember, we're your silver lining.
Thanks for joining us. We'll see you next time.
Bye.
Bye.
Thank you for joining us on this episode of Your Silver Lining. We hope today's discussion was insightful and empowering. Aging isn't just about getting older, it's about embracing the journey and making the most of every stage of life. Through it all, we've got you. If you enjoyed this episode, please like, subscribe, and share it with anyone who might benefit. Your support helps us reach more people. Have a topic you'd love us to cover? Send us a message. Let's continue the conversation. Connect with us on social media or visit our website at yoursilverliningpodcast.com. Join us next time as we keep supporting you and caring for your loved ones. Until then, stay positive, be well, and remember, we are your silver lining.